Hi and welcome back to doc.offcall. My name's Maddie and I'm a doctor in the UK. Today we're going to be breaking down another medical scene in a very nostalgic and iconic movie, Quentin Tarantino's Pulp Fiction. Now, I love this film and I love this clip. I remember first watching it as a teenager thinking, my goodness, look how big that needle is. But now, as a qualified doctor with many years under my belt, I know how unrealistic this scene really is. So what we're going to do is we're going to break down the medical science in the scene, and then I'm going to give you my expert opinion as to how realistic this really is. So, if you're ready, let's begin.
Fuck out of my way.
Pig.
Quit fucking around and give her the shot. Come on. Okay. Look, while I'm doing this, you take off her shirt and find her heart.
So in this first scene we see John Travolta's character being tasked with finding Uma Thurman's heart. Now as doctors we use what are called clinical landmarks, and the one that we have for finding the base of the heart, which is otherwise known as the apex of the heart, is the fifth intercostal space in the mid-clavicular line. Now you can actually find this on yourself at home, and what you're going to want to do is have a feel halfway along the clavicle or the collarbone and then 5 ribs down, and that's where you should find what we call the apex beat. Now a rough location that you can use for the heart if you're not able to feel the ribs is just under the nipple, which is roughly in the 5th intercostal space in the mid-clavicular line.
That'll be exact? Yeah, it's gotta be exact. We were a shot in the heart, so I guess it's gotta be fucking exact. I don't know exactly where a heart is. I mean, I think it's right here.
That's it.
This it? All right, what I need is a big fat magic marker.
Okay, and what we're seeing in this next scene is this dealer character. He's basically opening up what we would call a sterile pack. Now we use sterile packs for all kinds of medical procedures, and what they normally contain are things like a pair of gloves, an apron, maybe a drape to place over the area we're going to be performing the procedure on, to basically keep the area as clean as possible and reduce the chances of any infection. Now, just as an example to demonstrate this a bit more clearly, I have one of those sterile packs here. So this is one that we would normally use for something like catheterizing a patient. And what you might expect to find in there are the catheter kit, as well as a pair of gloves, the apron, and also whatever other equipment that you need for the procedure. So it's quite commonplace to see these. Now, the funny thing about this scene is that, yes, he's got a sterile pack, but it doesn't look like anyone's really bothered about hygiene. But then again, it's a movie.
All right. Come on, man, hurry up. Fuck. Okay. I think it's ready.
Oh gosh, look at that needle. It is completely ridiculous. I mean, you would never see me using that on any one of my patients, and you can understand with people watching this scene how they might develop a needle phobia. That looks more like a weapon than it does a piece of medical equipment. Now, in all seriousness, the longest needle that you're probably going to come into contact with is a needle that might be used for taking blood, and really those are a lot smaller than this. Now, there are longer needles, but they tend to be reserved for more specialised medical procedures, and hopefully healthy people won't come into contact with those. However, just to give you an example of the type of needle size that we use for taking blood, this is the size that we're talking about. So comparing that to that of the one in the scene, there's a large difference. And another thing I'd like to say about this scene is we see him there drawing up the adrenaline from a vial. Now, as GPs and as doctors generally, we don't tend to carry around vials like this with us in the community, as it can be quite cumbersome drawing it up and getting the exact measures, especially in an emergency like this. So what we tend to carry around with us for emergencies only in our emergency kits are pre-filled syringes, which basically have the correct measure within the needle already, and all we need to do is inject it.
All right, please hurry up, man. Okay, hurry up. Here, I'll tell you what to do. No, man. I ain't giving you're gonna give it a shot. No, you're gonna give it a shot. I ain't giving her the shot. I never done this before. I ain't never done it before either, all right? I ain't starting now. Give it to me.
Here.
Give me that.
I love this scene where you see them fighting over who's going to need to give her the injection. And to be honest, I would be scared if I had to stab anyone with a needle that long. However, nowadays, as I said before, we have these pre-filled syringes which are so easy to deliver that patients can give it to themselves. You might be familiar, for example, with something like an EpiPen, which is basically adrenaline in a shot. Now, any patient who might need an EpiPen should be taught how and when to use it. And once demonstrated, patients are often more than comfortable to deliver it themselves should they need to.
All right, tell me what to do. Okay, you're giving her an injection of adrenaline straight to her heart, but she's got a breastplate. You gotta pierce through that. So what you gotta do is you gotta bring the needle down in a stabbing motion.
Just seeing this character demonstrate the stabbing motion for giving this injection takes me back to the good old slasher movies like Scream or Halloween. Now, I can't really comment on whether this was accurate practice back in the day, but nowadays it's not commonplace at all. The recommendation for delivering adrenaline in current practice is in the anterior lateral thigh, which basically means into the muscle on the outside of your thigh. Now, it's actually quite funny how many of my patients ask, do they need to inject the EpiPen into their heart? And this just demonstrates the importance of good education and clear instructions on how to use it so that they don't end up doing something silly or potentially dangerous like in this scene.
Okay, then what happens? I'm kind of curious about that myself. This ain't no fucking joke, man. Am I gonna kill her? No, she's supposed to come out of it like that.
So in this part of the scene, we see John Travolta asking how quickly the adrenaline should begin to work. Now, when injected into the conventional location, so the outer thighs we said earlier, we expect an onset anywhere between 5 to 15 minutes. Now, in this scene where the adrenaline is injected directly into the heart, I'm not quite sure what effect this is going to have. And in fact, I'm actually more worried about the potential side effects that any patient might experience, as whenever we give adrenaline through the IV route rather than into the muscle, it's normally advised to be given as a slow infusion rather than as a quick jab into the bloodstream.
All right, count to 3. All right, ready? 1. 2. 3.
Oh god. Yeah, it looks like you've just woken someone up from sleep with the way that she responded to that shot. And I definitely think they're over-exaggerating in this scene. And it's a little bit unsettling seeing that needle all the way in the chest with the syringe still sticking out of the chest, isn't it? So just in this last scene, we're seeing Uma Thurman's character after she's received that adrenaline shot, and you can see her hyperactive in this scene, jumping around the furniture. And you know, this is all as a consequence of that adrenaline. The adrenaline is basically like sending you into overdrive. It's raising your blood pressure, raising your heart rate. I'm sure she's going to be clammy, feeling nauseous, and it can cause potentially life-threatening side effects such as heart attacks or strokes. So you can understand why now we don't use this as the conventional way of injecting adrenaline.
If you're all right, then say something.
Something.
Oh man.
Okay, so what did we learn today? That's right, don't do drugs. No, in all seriousness, I hope I demystified this scene for you today, and hopefully I've reassured you that should you need an injection or should you need a vaccine like the upcoming COVID jab, you're likely to receive it through a much smaller needle. And for those of you who end up having an allergy, who might end up needing an EpiPen, you're not going to require a needle through to the chest. It's likely it's going to be a far smaller needle and a lot easier a procedure to carry out. Well, I hope you enjoyed today's video. If you did, please don't forget to like the video and also subscribe to the channel. And whilst you're here watching this video, why not check out one of these 2 videos where I break down the medical science in some other movies. Otherwise, thanks for watching and I'll see you in the next one. Thanks.